DC. Welcome to the Don't Mute Mental Health podcast, where we discuss all things mental health within the DC education system in order to help parents and community members learn more about the resources available to help support our students here in the district. My name is Renata, and I'll be your hostess for today.
Thank you, Jolia, for joining us today on the Don't Mute Mental Health podcast. I really appreciate you being here. Can you start off by just telling us a little bit about yourself and your role?
Absolutely. Thanks so much for having me. My name is Jolia Gorman. My pronouns are she, her, and I am a school-based mental health therapist with Mary Center here in DC. I'm partnered with KIPP Northeast Academy, which is a middle school and a public charter school in Ward 5. I've been working in school-based mental health for about 2 years and in the mental health field overall for about 6 years. And I'm a licensed graduate social worker here in DC.
Today, we're going to talk a little bit about the importance and the impact of trauma-informed care on our students. So let's first start off with just a basic definition. What is trauma?
This is a big question, so it's a good one to start with. I will share a couple of quotes from some really thoughtful people and then give kind of an overview after that. The first one comes from Renee Linklater, who is a member of the Rainy River First Nations in Northwestern Ontario. And she says that we can refer to trauma as a person's reaction or response to an injury. And that's how I like to think about it, a person's reaction or response to an injury. She continues, the term trauma originates from Western context. It implies that the individual is responsible for the response, rather than the broader systematic force caused by the state's abuse of power. Trauma is intergenerational and multi-generational. From Bonnie Burstow, she says, trauma is not a disorder, but a reaction to a kind of wound. It is a reaction to profoundly injurious events and situations in the real world, and indeed a world where people are routinely wounded. And finally, from Gabor Mate, the essence of trauma is disconnection from ourselves. Trauma is not terrible things that happen from the other side. Those are traumatic. But the trauma is that very separation from the body and emotions. So the real question is, how did we get separated and how do we reconnect? So in general, coming from those three quotes, trauma is a person's reaction or a response to an injury. And in that, a separation from ourself.
Now, that injury doesn't always have to be like a physical injury, right? Can you give us some examples of what trauma may look like or some traumatic situations?
Absolutely. So any injury, wound, event can be traumatic and separate us from ourselves. So anything in the world can be traumatic. If we want to think about common and not so common traumas, we can first think about it from the perspective of traumatic events that can happen to anyone regardless of their skin color, class, gender, sexuality, or other characteristics. These could be a death, the loss of someone that's very important to them, an accident, something like a car accident that they're involved with, or physical, sexual, emotional abuse. These are all examples of traumatic events. But I think we also need to think about the traumas that happen because of things like a person's skin color, their class, their gender, their sexuality, and other characteristics. And these traumas can be because of poverty, police violence, state violence, migration, the death of someone that's important to them because of an unequal access to healthcare, hate crimes. Really, anything can be traumatic, and a traumatic event can happen to anyone. The more I learn about trauma, the more I see it just everywhere, in all honesty, just everywhere. We all just experience different kinds and degrees of trauma, which, remember, this is the response to the traumatic event. We experience different kinds and degrees of trauma, and that's based on things like genetics, a person's perspective, and their communities of support if they have them.
Thank you for that. I know within this pandemic, especially, and this distance learning time, we've seen not only traumatic events that we've experienced with students before, but a lot of those things just kind of magnified
Mm-hmm.
within this time, right? What is the
Mm-hmm.
impact of some of those traumatic situations on students?
Mm-hmm. Absolutely. So first off, it's very normal for one traumatic event to impact people in very different ways. However, trauma can take on some characteristics that we can notice and that are across the board. So sometimes trauma can impact a student's ability to sleep at night, to eat on a regular basis, and take care of their hygiene. Trauma can impact a student's ability to use their prefrontal cortex, which is still developing for the students that we are working with, which then impacts their ability to focus, to make healthy decisions, and to see the long game of their life, which leads to things like what we call impulsivity or mood changes. It's just a really difficult time seeing how something will impact them a few weeks down the road or a few months down the road. Trauma can impact a student's ability to handle stressors and triggers, to interact healthily with peers and manage relationships, specifically in that long game kind of way where they don't just cut someone off immediately because of one conflict or one thing that happens between them that seems like disrespect.
Mhm.
And finally, trauma can impact a student's ability to maintain positive self-regard for themselves and thus avoid situations that put them at risk. So these things that are called a lot of times by adults risky behaviors, trauma can impact a student's ability to avoid those.
Mhm. Now, when we talk about trauma informed care, what really is that? Why is it important? And what are some of the benefits of trauma informed care?
Mm-hmm. The trauma-informed care is care of whatever kind, whether that's a teacher taking care of a child in school, a primary care physician taking care of a child, CFSA taking care of a child in a crisis situation, or a therapist taking care of a child. It's any type of care that is informed about trauma and the way that trauma impacts the way that children and adults behave, think, feel, and interact with others. Hopefully, trauma-informed care is rooted in an intersectional understanding of the way someone's skin color, class, gender, sexuality, or other characteristics is weaved into what the traumatic events are and what their trauma is. I don't tend to love giant organizations that do things like definitions, but I think that the National Child Traumatic Stress Network, which I'll link at the end of our time together to learn more from, does a
Mhm.
really good job at spelling out what trauma-informed care is and how it specifically works. So just a quick shout out to them. The reason that trauma-informed care is important because it can prevent a person who is traumatized from being re-traumatized or traumatized more. It is a way to reduce harm and to promote healing for a person. So let's take it from an education standpoint. If there's a teacher who notices that a child has really been struggling and is not able to focus in class, instead of jumping to a thought of, oh, this child is unmotivated or this child is manipulating me or whatever the thing is, if that teacher takes a trauma-informed lens to the student, they might ask the student some questions to try to figure out if there's something going on outside of the classroom. And maybe that teacher discovers that when the child gets home, they don't know if they're going to have dinner, and that's just been happening for weeks. That helps that teacher to respond in an empathetic way that will reduce harm for the family, because hopefully that teacher would work with the social worker or the MHP or the school-based clinician to get that family hooked up with some resources to mitigate that problem. And it helps the child see that, hey, this teacher really cares about me, which is going to help that child engage more in class. Because if we keep a strengths-based perspective about children, we think that they do want to succeed. They do want to engage in class. There's just something that's blocking that. Trauma-informed care is so important because it helps highlight the thing that's blocking that child from being who they are and who they're meant to be in ways that reduce harm and promote healing. So to finish up, the benefits of trauma-informed care, like I said, it's less harm being done to an already traumatized person. There's more healing for that traumatized person. And I think it also helps reduce a feeling of helplessness on the part of the caregiver, because I can empathize with a teacher who is working with a student and is just like, I don't know what's happening here. I don't know why this child isn't engaging with me anymore. Having a trauma-informed lens and being able to think about what's happening outside of the classroom, I think helps reduce the feelings of helplessness and gives the teacher something to be thinking about and something to be asking about in a thoughtful way that can help that student succeed.
I think it's really important that you brought up that this is something that happens not only in the relationship between the student and the teacher, but also between, the student and their therapist or their school-based clinician. I think that a lot of times when we think about care for students, our mind automatically goes to like a school-based clinician or school-based therapist like yourself. And we don't quite remember that, caring for a student is a holistic approach. It not only includes the family's response, but the student's teacher's response, the school's response. All of those things are kind of intertwined.
Absolutely.
And it's important to remember to keep trauma-informed care at the forefront in each of those spaces. So I know you mentioned that this is something that, teachers often take this approach or other school-based leaders take this approach. Is this something that a person is trained in, or is it more so just a general practice?
I think that it's something that a caregiver should be trained in. This is a learning how to have a perspective with every single student or every single person that you're interacting with. Unfortunately, not every graduate or undergraduate level program talks about the impact of trauma, and even less of those, from my perspective, do it from an intersectional BIPOC is Black, Indigenous, people of color centered perspective. Being trauma informed doesn't mean that you have to get like a certificate or that you'll ever really get to a checkbox or a finish line that like, oh, now I am trauma informed for all the things. This is something that we're always, or that speaking for me, that I'm always learning about and I'm always trying to get better at and always trying to get closer to that finish line. So it is something that caregivers need to be trained in. And I'll give some resources at the end of our time that have been really helpful for me to get closer to that finish line of what being a trauma-informed clinician looks like.
And we'll be sure to have any resources, books, references that we've spoken about during this time linked in the notes for the podcast. So to our listeners, please feel free to check those out as well. What does trauma-informed care really look like at the school level? And now, especially that we are in this virtual learning space, what does that look like in terms of teletherapy?
I really appreciate that you ask about these two things in kind of two separate questions because it looks different. And that's just from the very practical standpoint of a school has access to every single student and every single family. If you are someone that thinks in terms of tiers, the tier 1 kind of things can be done really easily on a school level that reach every single student and every single family. A therapist like myself usually can work with about 20 to 25 families because our work is deeper and it just needs to have that sort of boundary on it so that I can give good care to the families that I'm involved with. So it's different. On a school level, I think that trauma-informed care looks like having more than enough mental health professionals at your school building. And I do think that the Department of Behavioral Health and the State Board of Education here in DC is doing really good work to try to get more mental health professionals in the physical school buildings, which is very much appreciated. I think it looks like having a robust network of partners for your school to offer for resources to families, things like job training, food assistance, rent assistance, transportation assistance, programs for returning citizens, these types of programs that can honestly come in and prevent traumatic events from happening. I think it looks like teachers knowing the signs of trauma and thoughtful ways that they can respond in the moment, and then also knowing how to refer students to deeper supports if they need those. Because not every student needs deeper supports if they've had a traumatic event, like we talked about before. Traumatic events impact us in different ways. And then finally, I think that trauma-informed care at the school level looks like administrators at schools supporting students and staff emotional needs before the academic ones. And I know I'm a therapist and that my thought about this is biased, but I really feel like this is important, especially in the time that we're in right now, this giant global pandemic, this giant global grief that we're dealing with. I am originally from Texas, and I'm just really disappointed that the State Board of Education there is, as far as I know, is still moving forward with standardized testing for all the students this year. That is not trauma informed. That is the opposite of trauma informed. And so I really think that administrators at school really need to think about the students and staff emotional needs before the academic ones. So kind of on the other end of the spectrum here, with the one-on-one and the small groups that a lot of times teletherapy is involved with, I think it looks like a lot of grace and patience right now for trauma-informed care, having grace and patience with the students that we're working with who are at home. And home looks very different for a lot of different families. So having lots of grace and patience for them and also for ourselves. I think clinicians that we need to be aware of the traumas that are happening on societal levels and being prepared to hold space for that grief. If you are not prepared to do that, that's okay that you're not, but it's not okay to not get the training or the supervision that you need to be able to do that for the families that you're working with. This can look like knowing ways to ask questions that acknowledge different kinds of traumatic events. Specifically for white clinicians, and I am a white clinician, so I feel comfortable saying this, white clinicians, we need to do what we need to do to decenter whiteness in our therapy work with families. And if I'm speaking to a clinician that is especially goal-driven, you like working with therapy curriculums like TFCBT or internal family systems or CBT, which are great and I use, but if you like doing that kind of therapy, right now, I'm going to encourage you to put your participants' needs before your own needs to finish task or to follow a certain curriculum for therapy. In general, teletherapy, we need to be doing a ton of outreach, and meeting students and their families where they are. On a big systemic level, I think that insurance companies need to be waiving all the stipulations that keep people from therapy right now. Just all of them. So that also needs to happen to be able to make care and access to care equitable.
Yes, no, most definitely access is important because if you can't access it in the first place, then you can't receive the care. So thanks for bringing that up. I know that in my experience as a teacher in the past, and I'm sure with so many other teachers feel the same way, there's so many things happening within the school day that sometimes it's kind of hard to have that moment to connect with a child about emotionally what is going on or what's going on outside of school, just because the school day goes by so fast. And so there might be moments that you as a school-based clinician have where you can have a little bit of a deeper conversation or be able to connect with that child a little bit more than they would in the typical classroom. Do clinicians work with teachers or other school staff to be able to find better ways to support students throughout the day?
Absolutely. So I would say if you are a teacher and you have access to a mental health professional at your school, whether that's through the DBH program or your school staff, ask them. We have tons of ideas on ways to do maybe those like short interactions throughout the school day in the classroom with a child to really help them to de-escalate if they are having a trauma response in that moment. There's a ton of things that are really easy to do and kind of short that a child can do in the classroom. Or if they need to go out of the classroom, then yes, we can be available and we can definitely be supportive in being real time, checking in with that student, doing it at a later time, if that would be better, to check in with that student and that family. Things like getting them connected to ongoing resources like therapy. And we also have a lot of ideas for tier 1 interventions, or things that do have, or that all students can access. There are lots of ways for students and families to be supported, and for teachers to learn how to do that with all the things that you already do. It's a lot. It is a lot to be a teacher. Much love, mad respect for teachers. And so we're here to support you as well with your own personal mental health, because it is hard to be an adult right now in all the things going on. And then also in your work in supporting the students. So yes, ask us. We love being involved.
And I think it's really important you just brought up the mental health of our teachers, right? Because if our teachers aren't in the right mental space to be able to support our students, right? Like that's what's most important. Most definitely.
Absolutely.
So I want to go back to something that we briefly mentioned before, and we talked about how supporting a child should be more of a whole child approach. Like it's not just something that a school-based clinician is doing. It's not just something that the parent is doing. You know, it's something that the whole school is taking on. The teachers, the school staff, working in conjunction with the school-based clinician, with the parents, you know, that whole just network of care. I want to talk a little bit about trauma-informed care and what those different relationships kind of look like. So the importance between the relationship between the clinician working with the student, but also how does that differ from the school working with the child when it comes to trauma-informed care?
Absolutely. It really comes down to, like you said, a child being taken care of from a lot of different angles. It is important for every child to have access to trauma-informed care and something like social emotional learning or something like that. If we think about that from a school level, schools have access to each and every child and thus have a ton of power to enact programming. So let's think about the ways that in ELA classes, when we're practicing writing in general, is there a way that a child could get a prompt to help them process some of the grief that they've experienced from losing half of their school year, maybe their 8th grade year or their senior year of high school? There's power in the advisory periods with things like social emotional learning. Shout out to the school that I'm partnered with, KIPP Northeast Academy, that uses their advisory periods to practice mindfulness as a group. These are incredibly helpful and hits at overcoming trauma from an angle of like big group work and doing it with their peers. And then you take a look at something like a one-on-one connection with a therapist or a clinician of some kind. You know, we can do that and do a lot of different kinds of work that's more focused on that one child or that one family. And that hits it from another angle. And then the family get to, first, the parents hopefully are receiving the support and the care that they need so that they can show up and be their best parent. And then also be supporting their child in things like emotion identification and de-escalation, you know, helping their child when they are really escalated, just to say, hey, I see that you're angry and I understand that you're angry because of these reasons, or I can empathize why you'd be angry about this because, yeah, it sucks that you've lost your school year. It sucks that we can't go outside. I totally empathize with your anger. And sometimes just a child hearing that can be enough to de-escalate them, in all honesty. So in general, with trauma-informed care, it comes from all sides, all relationships that a child has. If all those relationships are trauma-informed, that child's going to have the best chance at overcoming any traumatic experiences that they have had.
And that's something that we even see in ourselves as adults, right? Like it's not just something with supporting our students. Like even as adults, we need that network of care. We need that care coming from all angles, especially within this pandemic, if we've learned anything from this, just the importance of support and reaching out and having that system of care for people to just
Absolutely.
meet basic needs, really.
Mhm.
So,
Absolutely.
Julia, you've shared so much with us during this time. Thank you so much for all of the knowledge and just the wealth of resources that you've provided for us. Are there any other resources, books, just information that you want to give people so that they can learn a little bit more?
Absolutely. Absolutely. Yeah, this is your first or you haven't had a ton of interaction with trauma-informed care, I would really encourage you to do some deeper dives on this. It's incredibly important, and I have tried to synthesize some ideas. This is a big deal, and it is a big deal because it has a ton of power to do a lot of good and a lot of harm reduction. Some places that I have learned a lot from, first of all, I have a couple. First one is a book called Decolonizing Trauma Work, Indigenous
Yes.
Stories and Strategies by Renee Linklater. I talked about her earlier. An Instagram account that I really love is from a woman named Dr. Jennifer Mullen, who is a psychologist, I believe, off the top of my head. Dr. Jennifer Mullen, her Instagram account is at Decolonizing Therapy, and it has done wonders for my ability to bring trauma-informed care into all of the work that I do. I would also encourage you, especially if you're a clinician, to look into somatic experiencing and the work of Dr. Peter Levine. I think it does a really good job at connecting the bodily, like physical responses that we have to trauma and ways to enact healing. As I said earlier, the National Child Traumatic Stress Network has some really great resources specifically on what trauma-informed care is and how to enact it in different places. And then finally, shout out to teachers, administrators, and school staff. I would really encourage you, if you haven't ever watched, it's a 5-minute YouTube video called Survival Brain versus Learning Brain. And it is incredibly informative as to the importance of why a child needs to have this type of care to move from being in survival brain into learning brain. There's a very big difference within those two.
Mm-hmm.
That's what I would suggest getting a start on in learning more about trauma-informed care and its importance.
Thank you. I think oftentimes when we think about learning more about these things, we're always like, oh, I need to read this extensive long book, or I need to read this case study that someone's written or paper that someone's written. But there's so many resources out there. And especially in this virtual world, places like Instagram accounts from psychologists or even a YouTube video where we can learn more. So I always love to appreciate people to try to find different ways that you can learn about a topic. So thank you for giving us a variety of ways to do that.
Sure.
So we've come to the end of our time. Again, thank you so much, Julia, for joining us today. I know that I learned a lot. I'm sure that our listeners have learned a lot. Again, we'll be sure to link all of these resources and books that Julia has mentioned in the caption for this video. So please feel free to take a look. And thank you so much for taking the time to listen today and to join us. And we will see you next time on our next episode. Take care.